I'm Dr. Rick Green, Senior Medical Editor of General Surgery News, and we're coming to you from the 87th annual meeting of the Southeastern Surgical Congress. And today it's my absolute delight to be interviewing a good friend, colleague, and a true leader in surgery in the United States and around the world, Dr. L.D. Britt.
Well, you're very kind. You and I go way back.
L.D., welcome.
Thank you.
You've been involved in education for a long time, especially with residents.
Right.
You've been involved in organizational work for many years. In this generation of our trainees, what do you tell them to keep them involved in organizations? It's a sort of a different culture of trainees, I think, from perhaps when I even went, and then maybe when you went through your training. What do you say to them about being involved in an organization like the Southeastern?
Well, we need their involvement in organizations. As you know, there are forces out there trying to change the paradigm of training, change the paradigm of education. And unless you're part of an organization providing leadership, those changes occur. And I'll be quite honest with you. I was chair of the RRC Residency Review Committee at the ACGME. While I understand their role, I'm not sure they're doing the best as far as dictating how we should train surgeons. And the only way you can counter that is to be in organizations providing leadership and pushing back, because this is a troubling time.
You know, we've had conversations before. Of course, we have organizations like the ACGME, RRC. In some countries, the organization, the professional organization, has oversight on residency
And I'm
training.
glad you said that, because if I had a magic wand, Rick, I would have the college do what all the Royal Colleges in UK, what they're doing is to provide accreditation for the training programs for surgeons. There's no reason for us not to do it. I have nothing against ACGME, but I think they don't have the same focus and the same emphasis on what it requires, what is required for a surgeon to be trained. I mean, the 8-hour work week was not based on any scientific evidence, you know that. Some of the changes they've done, no evidence to support it. They decided that this is something we should do. Well, as a result, we're turning out, in my opinion, this is not speaking for the college, inferior products. Now, we cannot allow that to happen.
Well, certainly the first trial, and I think the second trial, has shown that we haven't caused patients to suffer by relaxing these 80-hour work week rules.
Well, I'm glad you said we haven't changed. Okay, we haven't had any positive outcome from these changes. The residents are not better trained. They're not better educated. They're not passing the boards anymore. And so at the end of the day, why did we do it?
Well, as past president of the American Surgical, past president of the American College of Surgeons, where do we go with this? Where do we go with this concept? We talk about it, but should we take it to the next step?
We should, but we should do it in a modular way. Maybe start with non-ACGME type training programs to lay the footprint of obviously accrediting training programs, and then broaden it out. I still feel, and I'll say this publicly, that it's time for the college to do what the Royal Colleges are doing. Let us be the umbrella for training programs.
Let me ask you another question. As you well know, the NYU, New York University, has announced that it will not charge any tuition for medical students coming to the medical school going forward. Kaiser Permanente is starting a new medical school in California. They've decided they're not going to charge. What do you think of this concept? And you know and I know that students come out today with terrible debt. Is this something that your medical school, that Eastern Virginia Medical School, should push for, or my institution?
We should push for it, but we don't have the funds for it. Most medical schools don't have the funds. You got to be kidding. I applaud NYU. I don't know how they did it. That's like sausages. I like sausages, but I don't know how they're made. And I'm not sure how Kaiser did it, but most medical schools can't do it. We would go bankrupt if we did that. We just don't have the funds. A lot of these quote unquote state supported schools, they get less than 10% of their budget from the state. And so we just can't afford it. I think most medical schools can't afford it. I think there was some unusual situation that NYU was able to do it. I applaud them, and Kaiser, but most of the medical schools can't afford that.
It's been an absolute pleasure to have Dr. L.D. Britt here at the 87th annual meeting of the Southeastern Surgical Congress. L.D., thank you.
Excellent. Thank you. Always
beautiful interview.